Hey, quick recap. Sharon, 53, from Manchester, and on Wednesday I had a neck lift, lower facelift and upper eyelid surgery in Turkey, Istanbul. It's Saturday morning, so this is day 3 post-op. I had the procedure, excuse the voice, I've lost it through having the tube down the throat, I think. I had the procedure on Wednesday evening around 5 p.m. and it is now 7 a.m. on Saturday. So yeah, 3 days. I woke up super early, wanting to take all my strapping off just for an hour, just to give everything a bit of breathing. Also, I have quite a lot of swelling in this eye, and because the corset is so tight on the face, I just felt that this had nowhere to go. It's just trapped here. So I've taken it off and I have been massaging it. I don't think it's infection, it isn't sore, and I am on antibiotics generally for everything I've had done, and also antibiotic eye drops as well. So I woke up with this yesterday morning. This did not present itself until then. So yeah, it's all part and parcel. Pretty pleased with what I'm seeing so far. I did take the strapping off yesterday, just briefly, to change it. Clearly it's very, very early days yet, but the neck is brutal. And there's a stitch line under there also. They cut across there so they can access the platysma muscle. All this is called the platysma muscle, which is what they pull up and stitch behind the ear. This is one of the access routes, as well as these points as well. I've had a deep plane facelift, which means not only the skin but the muscle is basically cut away from the face, lifted off the face, and for want of a medical explanation, they'll put the hands down and just pull everything back up, stitch it back on to where it used to be 20 years ago. I don't know whether you saw my post yesterday, but I did point out to me having this slight asymmetry of the mouth here. I think it's called ptosis. You will often see it where maybe people have had Botox injected incorrectly, you know, and they might get the droop of the eye. So yeah, I spoke to the surgeon. He said it's very, very common, and also I do follow a lot of people on here on TikTok that have had the exact same procedures, and they also experience the same asymmetry after their procedures, and I'm assured it will come back. You know, the nerves have not quite woken up yet, and they have all been crushed under that garment for 3 days now. So yeah, day 3. And I'll check back in later with Paul. If you have seen the previous post, Paul is doing fabulous. He's way ahead of me in the recovery. You would think that he had his procedure a week before me. He has just like snapped back. We both do have different surgeons, and Paul's stitching pattern is different to mine. I don't know whether that's because the male and the female form My stitching goes right to the top of the ear, so bottom to the top and rounds off, whereas Paul's stitching just goes halfway. I'm assuming, maybe wrong, but if he was to have his face pulled all the way up here, then that would possibly feminize him, and yeah, maybe that's why it's just not a masculine thing to do, is to have the whole face pulled this high. His has been pulled halfway here. But yeah, he's got virtually no swelling, slight bit of bruising under here. He bounced right back from the anaesthetic, whereas I was sick for, oh God, 36 hours later, I still had the nausea. So yeah, he's a unit. Anyway, the next post will be him. Everything is totally numb. Cannot feel this. I can feel it, but I can't feel it. Ears are numb. This side not so much, and I can feel this ear. Oh, as well, top tip, if you're having this done, these, oh, the pleasure I got this morning when I took off my strapping, running these under hot water and just rolling them around inside the eyes. You know, just cleaning all the areas. I cleaned very gently inside the ears. These were absolutely full of matted blood. And the hot water, oh, it was almost orgasmic. In fact, I had to tell myself to stop because I'd been here 25 minutes just cotton budding myself. Yeah, so that's it for now. I'm just going to take my antibiotic tablets and hope my voice hope my voice finds its way back again at some point today. Okay.